Want to see what one of the most successful treatments for shoulder injuries looks like? Does that hurt? Well, maybe you should keep watching. Hi, my name is Dr. Lindy from Balanced for Life, and the most common shoulder injuries our clinic sees are rotator cuff tears, tendinopathies and bursitis. Now, the rotator cuff is a collective name given to four muscles that help move the arm: the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. Now, when these muscles overwork or they're not in the right position, they can cause tearing and swelling and inflammation. These injuries are often due to overuse, poor movement over time, and are more common in people over the age of 40, in athletes, or people that do overhead movement frequently, like tradesmen, carpenters, and painters. Now, without treatment, these injuries may lead to a permanent loss of shoulder and arm range of motion, weakness, and progressive degeneration. As a chiropractor, I strongly believe in rehabilitation and improving the movement of the shoulder joint. However, in order to do that, sometimes we just need to minimize the pain so that we can get our hands on the injury to begin working and rehabbing it. At Balance for Life, we use a therapy called photobiomodulation. It's not a hot laser, it's actually a cold laser using a multi-wave locked system combining two types of laser energy. Now, this light energy enters the damaged cells and stimulates the intercellular activity that reduces pain in the area, reduces inflammation, and speeds up the recovery of damaged cells. An average treatment lasts about 15 minutes, is painless and has no side effects, and it can be used on both chronic or acute pain. Patients often ask, does a laser session hurt? If you were to get a laser treatment, it would feel like taking a flashlight and moving it over the shoulder. However, unlike a flashlight, the laser penetrates the tissue and pumps it full of a specific kind of energy. As a result, the effects of the laser treatment are accumulative. So each treatment builds on the last, and the amount of sessions depends on how long the pain and injury has been present. For example, if you have an acute injury, 4 to 6 treatments can make a huge difference. However, for a chronic condition like arthritis or an old injury that has never healed, 10 to 12 treatments are required. So why not consider laser therapy for your injury, or even someone else who you know that has had that kind of injury? And why am I sharing all this with you? Because at Balanced for Life, we know that moving your shoulder better matters.